Now, if we want to know how well our country is dealing with it, it would be a good idea if we compare it with other countries. Starting with the USA, the first thing we can notice is that they have plenty of institutes of neurology, involving neurological research and hospitals that treat neurodegenerative diseases. This is the case of Boston's Children's Hospital, which, as its name says, is specialized for kids. The Mount Sinai in New York, Kennedy Krieger Institute in Maryland, and the Laboratory of Neurogenetics in the National Institute of Aging are some other examples. What's more, they are so committed to this area of study that even universities have neurological research centers. This is the case of the University of Los Angeles, which has a health institute for neurogenetics. We can also compare how much they invest in this science every year. According to Statista, their investment has practically quadrupled from 2006 to 2022, growing from $481 million to $1,673 million in 2022. Now, if we move from the USA to Western Europe, we will find that most of these countries have created neuropathology associations around the decade of the 50s and the 60s. We can point out countries such as France, UK, Germany, Italy, or Switzerland, but the majority of them had been developing critical thinking about neuroscience and neuropathology since the late 19th century. Austria, for example, founded the first institute of neurology in the world in 1882, and the Austrian Association of Neuropathology was founded in 1956.
On the other hand, Peru is a totally different story. Only two organizations in the whole country are involved in this branch: the Neurogenetics Research Center and the National Institute of Neurological Science, both located in Lima. Despite that, a considerable part of the patients come from provinces, and as you can guess, there is little to no access for all those people that live in regions that are far from Lima. Moreover, the institutes don't own the staff, equipment, and infrastructure needed for pre-symptomatic diagnosis, and since formal training programs in genetic counseling are yet to be available, neurologists specializing in genetics are the only ones that provide counseling. Furthermore, neurogenetic diseases are not even considered a priority. Yes, it's a fact that during the last years Peru has been slowly making progress. However, this is constantly hindered by lack of communication, disorganization, and other external factors, namely the issues taking place in the political world. In view of this problem, we cannot sit idly by and just wait for something to happen. We must act. As ordinary citizens, there is no other option for us but to spread awareness among people, explaining this issue, and we're going to do so by carrying out the following plan. First, our team made a video regarding in detail the current situation of neurogenetics from a global and national point of view for the students and teachers of our school, which is the one you're watching right now. Besides, we're posting a video on TikTok as its massive popularity and spreading will be crucial for the project, helping us to get a message to more people. Our aim is to raise awareness of this problem and to show that there is a way to solve it. All these years we've hoped authorities would take action and all we've got was nothing. We cannot let this happen anymore. So go and spread the message. Check out our TikTok and share it with your family and friends. Perhaps one of us is ignored, but together as a unit, our voice is gonna be heard.
In conclusion, both healthcare systems and patients face considerable difficulties due to the absence of neurological diagnostic facilities in Peru and around the world. People of all ages are affected by neurological illnesses, which have a significant negative impact on morbidity and death. However, particularly in developing nations like Peru, the accessibility and availability of diagnostic services for neurological diseases are frequently constrained, meaning that most people don't have access to these facilities. The complexity of these illnesses is one of the main causes of the lack of neurological diagnostic facilities. The term neurological conditions refer to a broad spectrum of illnesses and disorders that need specialist tools and knowledge to be correctly diagnosed. Unfortunately, due to financial limitations, infrastructure restrictions, and a shortage of qualified healthcare workers, many healthcare systems, especially in resource constrained contexts, find it difficult to achieve these needs. The absence of neurological diagnostic facilities in Peru and around the world is a grave issue that needs to be tackled immediately. We can work toward improving the diagnosis and management of neurological disorders by addressing this challenge through increased investment, healthcare professional training, and the integration of cutting edge technologies, ultimately improving the quality of life for millions of people who are affected by these conditions.